The views, information, and opinions expressed during the following program are solely those of the individuals involved and do not necessarily represent the views of Access Communications, its representatives, or its employees.
Today's keynote addresses one of the most pressing issues, I think, in healthcare, the spread of misinformation and its impact on patients, families, and communities. And it is my privilege to introduce André Picard. André is one of Canada's most respected health journalists and a longtime columnist with the Globe and Mail. He has been recognized nationally and internationally for his thoughtful, evidence-based reporting on health policy and public health. His work consistently challenges us to think critically and act responsibly in the face of very complex health issues. Please join me in welcoming André Picard, and there will be a chance for questions after André's presentation. Thank you, André.
Great, thank you for that very kind introduction. It's always a pleasure for me to return to Saskatchewan. I spend a lot of my life traveling around the country. Always nice to come back to the birthplace of Medicare, and to come to Regina, a city that has unique and progressive primary care models like the cooperative health clinics. This model, as you know, is more than 60 years old, but it's more relevant today than it's ever been. The whole notion of paying fee-for-service is not working. They have a model of paying salaries, so it's actually very much ahead of its time, and I hope it'll blossom again. Now, today, I'm going to talk about a subject that I don't usually talk about. I usually live it. I usually talk about Medicare, how it's important to give life to our values, etc. So I'm going to have a little different topic today. In fact, I'm going to talk about a global pandemic. Not COVID-19, so I think I heard a big sigh of relief there. A different pandemic, the pandemic of global misinformation and disinformation. In recent years, we've faced an increasingly violent tsunami of lies and half-truths and conspiracy theories and politically motivated falsehoods. It's impregnated our daily lives. In the last week alone, we've been told that 3 different things are responsible for autism: Tylenol, aluminum, and circumcision. The biology of those I have a little struggle with. I'm not sure exactly how it works, but there you go. And by the way, just for the record, none of these things are even remotely true. Now, vaccination in particular has been under constant attack. We've seen normally reasonable people reject COVID vaccines for a host of bizarre reasons. We've also seen parents, well-meaning parents, grow increasingly hesitant about childhood vaccination. Unsurprisingly, once invisible childhood illnesses like measles, mumps, and whooping cough are making a comeback. Vaccination has to be part of the social contract. Everyone for himself doesn't work. It doesn't work to keep a population healthy. It's not how public health functions. And I think Dr. Shahad would agree with me, and he knows this better than I. We're literally turning back the clock to a time when children routinely got sick and far too many died. And why? Why are we doing this to ourselves? That's what I want to talk about today. The real tangible harms of misinformation and disinformation, as well as the root causes of this epidemic and the necessary responses. And I hope I can leave people with some tips on how to arm themselves against this viral threat. Now, local providers and clinics like the Regina Community Clinic also play a role, as they are trusted voices. And I'm going to have a lot to say about the role of trust and the trust in healthcare workers. How do you inoculate yourself against the spread of nonsense and lies? That's become one of the biggest challenges of our time. So I want this to be more conversational than academic, and I want to leave a lot of time for your questions. So I don't have any PowerPoint, any bells and whistles. I'm just going to talk, old school, like they did 60 years ago, before we had all all this crap that we had to use. So, speaking of crap, I attend a lot of conferences and I listen to lots of speeches, many more than I give. And if there's one thing I've learned is that you rarely remember more than one thing from a speech. If you remember one, it's a good day. So here's the one thing I hope that you'll remember above all else today. Misinformation and disinformation are bad for your health. They're very bad for your health. Bad for the health of the person, of the planet, and they're bad for democracy. That's why we should care. Misinformation and disinformation are commonplace. It's estimated that between 2% and 29% of overall news consumption is false. And it depends what you read, especially what social media you follow. But the proportion may actually be higher for specific groups, such as old people, like me, people with only a high school education, people who go to the wrong social media. I won't name any other than Twitter, but there's a lot of problematic stuff out there. Most concerning is that the proportion of false information is highest in the area of health. It's really ripe for snake oil salesmen, and there are a lot of them. And just as an aside here, I should say, I won't use the term fake news today. I don't like that terminology. I think it's been co-opted by those who use it to describe things they don't agree with, which is not what its initial meaning was, which was false claims. So I don't use that terminology at all. So there'll be no fake news here today. But all this to say, this is a deeply important issue, as important as any pathogen. So that's why you should care, and I hope you do care. And I hope you'll care a little more when I'm done speaking. Now, I've already on a couple of occasions used the terms misinformation and disinformation. So I want to begin by defining these terms. Misinformation is false or inaccurate information, getting the facts wrong. It's usually not deliberate or malicious. All of us spread misinformation all the time. It's okay, but if you do, try and correct it. Misinformation, though, is still harmful, even though it's not deliberate. Disinformation is something else entirely. It's false information which is deliberately intended to mislead. It's intentionally misstating the facts. It's malicious. Disinformation is often used as a weapon, a political weapon. And we know who the general in that war is. It's Donald Trump. Now, some academics break down the distinction further, listing 7 types of misinformation and disinformation, or as it's sometimes called information disorder. So, number 1, satire or parody or irony. We don't always think of those as misinformation, but they are. The intention is to fool you, but there's no intention to cause harm, but it can. It can, especially if it's distorted, shared out of context. So if you see someone saying something satirical and then it's presented as, oh, they said this politician was this, when in fact it was just a joke. That's a pretty mild one. Number 2, misleading content, using information in a misleading fashion to frame an issue. Clickbait headlines are an example of this. I saw a striking example of this week, a headline that read, "Diet Coke causes liver disease." But that's not remotely what the research said. What it said is that people who are heavy drinkers of Diet Pop have a slightly higher rate of fatty liver disease. There could be many other reasons for this apparent link. Chief among them, that people with obesity are the main consumers of diet drinks, and being obese is bad for your liver. So that's an example of, you can figure out why things happen, but it's not necessarily what was in the headline. Number 3, imposter content, when genuine sources are impersonated. This is a form of disinformation that takes advantage of people you trust in a specific organization, person, or brand. You may have seen phony ads where celebrities seem to be promoting a product, but their likeness has simply been stolen. They're actually not promoting it. Number 4, fabricated content. So content that's 100% false, designed to deceive and do harm. If you've seen deep fakes, you'll know that distinguishing between the real and the fabricated is extremely difficult, especially to the naked eye. And this is getting particularly challenging with the advent of AI tools, where you can make anyone do anything. You can even make me dance properly, and I can't. I'm not suggesting you try. But. Number 5, false connection. This is when a headline or a visual or a caption doesn't actually support the content of something it accompanies. An example of this I saw recently was a headline that said, "Disabled people offered MAID instead of housing." You know what MAID is, medical assistance in dying. But what the story actually said is that someone was claiming that they'll seek assisted death if they don't get a better apartment. And it did mention also the fact that it was very unlikely it would be granted. So that's a very different connection to reality. Number 6, false context. When genuine content is shared with false contextual information, you can use a grain of truth to tell a false story, and people often do. For example, you can use an image from years ago and claim it's happening now. We see this often. We see false reports of shootings, of mass shootings, and here's a video, this is what's happening, and it's not true. It's something from years ago. We have to be really careful about that to make sure incidents are real, or that they're in the location where they claim to be. And finally, number 7, manipulated content. This is when genuine information or imagery is manipulated to deceive you. Usually this concerns photos and videos that are altered in a way that make them seem real enough, but there's always a little something off. Now, the point of this list is to demonstrate that misinformation and disinformation come in many, many forms. In my area, healthcare, I'm most concerned about false claims, particularly if they're spread deliberately, but also when they're spread unwittingly, because, as I said, both cause harm. Now, I said at the outset that misinformation and disinformation are bad for your health, individually and collectively. So let me explore that claim in a little more detail. How is it bad for your health to read stuff that's not true? Well, the harm comes in many forms. Number 1 is, of course, the health risks themselves. Misinformation about health can lead people to delay or reject effective treatments, including vaccines or cancer treatment. And what do? They instead buy into bogus or harmful remedies or useless remedies. For instance, false claims about COVID-19 and vaccines contributed greatly to vaccine hesitancy and ultimately increased mortality and increased long COVID. We had people refusing effective vaccines and opting instead for things like horse dewormer, an anti-parasitic drug called ivermectin. And ivermectin is actually something I've written about a lot. It's a really good case study of how half-truths and taking information out of context can be really harmful. Now, ivermectin is a great drug if you have parasites. It's not a great drug if you have COVID. The scientists who discovered the drug won a Nobel Prize for their work, but that doesn't mean it works for COVID. It's not a drug that works against a virus. It works against a parasite. And those are very, very different things. But all those things, it's a Nobel Prize winning drug, it's world famous, etc. All those were used to promote it, but to promote it for something that was not helpful. Financial losses. Misinformation can really hit your pocketbook. Can trick people into scams or bad investments, such as pump and dump schemes or cryptocurrency fraud, or buying really expensive so-called alternative medicines. Consumers waste a lot of money on fake and unproven products and lose confidence in reputable businesses due to false reviews. The global market for so-called alternative medicines is $180 billion worldwide, and a lot of those products are totally ineffective. Misinformation and disinformation could cause mental and emotional distress. Being exposed to misleading or exaggerated claims can cause confusion and fear and anxiety. Imagine you see a video pop up that there's a mass shooting at your child's high school, and it's not true. It's just all fake. It's going to cause you a lot of anxiety. A 2024 study showed that a significant number of Canadians experienced mental distress due to health misinformation. They just didn't know what to think anymore. It left them stressed out. Misinformation can damage relationships. The spread of information can strain your relationship with friends and family, particularly when health and political issues are intermingled. We saw this graphically illustrated during COVID. I don't know how many families I know where people are still not speaking to each other because of differences about the COVID vaccine or about lockdowns. It's sad and unnecessary. Misinformation can also harm the patient-physician relationship. This is really hard on doctors and nurses to have to deal with these false claims. Now, misinformation and disinformation can also cause harms to society, not just individuals. The most important of which is the erosion of trusts. Misinformation is undermining confidence in foundational institutions in society, such as government, media, scientific and health organizations. It fosters a climate of suspicion. It makes people more likely to disregard advice from legitimate experts in favor of quacks. Trust is an easy thing to lose, and it's very, very hard to regain. And I don't think we can even measure the level of loss of trust that's happened in recent years, and it's getting worse every day. Misinformation causes political polarization. By spreading false narratives, misinformation attacks, polarizes, and misinforms the public. This drives people into different silos, information silos, and this in turn fuels societal division and makes it more difficult for a shared understanding of basic facts to take hold. Remember those early days of COVID when governments actually sat together and they worked together regardless of whether they were liberal or conservative or NDP? We could use a lot more of that in our daily lives, but polarization gets worse every day. Misinformation is a real threat to democracy. You just have to read the papers every day to recognize that. Democracy depends on a well-informed citizenry, but misinformation can manipulate public opinion, undermine the integrity of elections, reduce political participation, delegitimize democratic processes and institutions. In its most extreme forms, it can lead to political harassment, hate, and violence. We're seeing this play out in real time in the US every day as it actually moves from democracy to dictatorship. Misinformation interferes with good public policy. The spread of false information can jeopardize the implementation of important public policies in areas like climate change or healthcare or many other areas. It can also disrupt efforts to contain disease outbreaks, lead to the misallocation of resources, and hinder progress on societal challenges. And there's a cost financially, economic disruption. When you create confusion and uncertainty, it can lead to higher unemployment, lower production, amplified business cycle fluctuations. AI-driven deepfakes and fake reviews have resulted in billions of dollars in stock market and revenue losses. A single video can change the results for a company forever. Now that's a lot of harm to a lot of people. So it's worth exploring who's most susceptible to believing false claims and why. Because I can tell you from experience, everyone says, I don't fall for that stuff. It's everyone else, but it's never me. But it is me and you and it's everyone. And it's not our fault. People are out there trying to trick us and mislead us. The social and psychological factors that make us most susceptible are important to understand. Now we know that the source of information plays a key role, as does repetition, as well as personality characteristics and political affiliations. All of those play into how we read news and how we digest information. Research suggests that detecting false information is very difficult and becoming increasingly so. So we can't always blame ourselves, but we have to be aware. When we encounter new information, we tend to focus on understanding it and deciding what to do next. Our priority is not to evaluate it for accuracy. You got to figure, what is this? Figuring out the accuracy is down the line a bit. Now, it takes effort to compare new information with what we already know. When new information is false but plausible or attractive for other reasons, we can learn and assume that it's a fact. I like that idea. If I buy this stock, I'm going to get rich. I think I'll believe that. etc. Yeah, vaccines, I had some doubts about that. I think I won't get one. I won't get my kid vaccinated, I'll wait. It doesn't make you a bad person, it doesn't make you an idiot, it's human nature. Now, several factors may increase our susceptibility to misinformation and disinformation. People are more likely to believe falsehoods if they hear them from people they trust. Peers have much more influence than experts. I often say this about vaccination and many health issues. It's those kitchen table conversations that matter much more than what public health is telling us. Sorry, Dr. Shahad. But, you know, your mum matters a lot more than any public official ever will. And your mum doesn't always know the right stuff, unfortunately. The emotional content really plays a role as well. People are more likely to believe false statements that appeal to emotions such as fear and outrage. Yeah, I don't like, that guy makes me mad. I'm not going to get that cancer drug. I don't like that guy. Emotion really plays a big part of it. And again, I don't want to keep harping on Mr. Trump, but he plays the outrage card really, really well. It's very appealing when he gets angry at stuff, even if it's nonsense. People are also more likely to believe misinformation that paints opponents in a negative light than they are to believe misinformation that's negative about their own group. We're willing to believe that, you know, those people that are politically different from us, everything they say is bunk. My folks, they just tell the truth. Again, those things are rarely true as well. Every group across the political spectrum has its issues. You have to be careful not to fall into those traps. And finally, people are much more likely to believe repeated information, even when it contradicts their prior knowledge and beliefs. You know, you've likely heard the expression that, you know, repeating a falsehood doesn't make it true. But research tells us that actually it does. It's easy to change people's minds by saying things over and over again. It's actually an effective tool of torture over time, but we do it more subtly in the media. When you successfully plant a seed of doubt, it's really easy for it to grow and grow. These findings suggest that it's important to stop misinformation early. That's really the key. Nip it in the bud before it's allowed to fester and grow. Now, susceptibility to misinformation also varies based on some of our individual traits. Educational attainment is one particularly. People who are more educated have more ability to analyze and dismiss things that are false. Not all of us are good at analytical reasoning. Those who are better are less likely to fall for stuff. Numeracy skills are really key. You can baffle people to death with statistics and false statistics. Anxiety can also increase a person's likelihood of believing false claims. I'm anxious, I want to believe this. Even though I have some doubts, I don't want those to make me worse, to make me more anxious. Now, older adults, again, this is from research. Research shows that older adults are actually better at identifying misinformation than younger ones. Makes sense. They have experience, a little more skeptical. You know, they've seen it all. The flip side of that coin is that older adults are by far the most likely to see and share false information on social media. The stuff your grandma puts on Facebook, it's appalling. That's the reality. I always say the worst people on social media are people in my demographic. Anyone over 50, they really fall for stuff much easier than younger people. So it's an interesting paradox. They have a greater ability to suss out falsehoods, but they're much more gullible. And I think a part of that is that they weren't raised in the social media world. Younger people, my kids, are much more skeptical, they're much more careful. I call them, is this a deep fake? I'm not sure. And they're like, come on, what are you, an idiot? Of course it is, look at, and they say, look in the left-hand corner or whatever. But, you know, this is actually what gives me hope, because I think young people are much better at figuring this stuff out because they've grown up in this, actually marinated in the world of social media, for better or worse. There's some good parts of it, thankfully. It's also important to recognize, too, that misinformation doesn't always lead to changes in a person's attitudes, intentions, or behaviors. In other words, what we believe doesn't always translate into what we do. We are very complex animals, we humans. Many people will become more skeptical, but only a tiny minority will fully embrace conspiracy theories. And that's good, but there's a whole range of harm that comes from the range of believing. Now, another area that requires some analysis, I think, is how and why does misinformation spread? Research tells us that people are more likely to share misinformation that aligns with their personal identity or social norms, when it's novel, when it elicits strong emotions. So those are all key clues that you should, when you're thinking, oh, should I believe this? You know, is it just because it's my personal politics it agrees with, because it's new and fancy, because it makes me feel a strong emotion? And again, we saw a striking example of this last week with US President Donald Trump. He said that women who take Tylenol during pregnancy are more likely to have children with autism. Talk about an emotional issue. Who wants their kids to not be well? He pushed all the right buttons to scare people, and that's what he does well. He pushed those buttons with falsehoods, and he did it over and over again. It was kind of a master class in how to spread disinformation. And to be clear, people take Tylenol, women take Tylenol during pregnancy because they're in pain, and they should. And that Tylenol does not cause autism. Maybe the underlying condition they're treating, like a migraine, maybe that has a link to autism, but that's a whole different story. But, you know, Donald Trump just kind of throwing the whole genetic puzzle under the bus in favor of a quick news hit, trying to answer his ridiculous promise that he'd reveal the cause of autism within a month. He did all this for political reasons, and he did great harm to people. We already have many reports of women saying, oh, I'm not going to take anything during pregnancy. I'm going to suffer. People shouldn't have to suffer because of nonsense. Anyhow, here's me getting emotional about an emotional issue. But this is actually a technique. It's a well-known technique called the fire hose approach. Every day, President Trump unleashes a fire hose of falsehoods. He tries to bury us in so much stuff that we don't know where to look. And it allows them to hide some really egregious stuff. And I'm using Trump as an example, but this is done by business leaders, it's done by union leaders, it's done by all kinds of people for all kinds of purposes. As I mentioned a moment ago, repetition is also very impactful. Exposure to misinformation increases the odds that people will believe it. So things get said over and over again. So you take that Tylenol press conference, after Mr. Trump spoke, RFK Jr. spoke, then someone else spoke. They all said variations on the same thing. They drove home their message. They drove home their falsehood. Now, as I said, the more people believe falsehoods, the more they will spread them. And that's important too. It is viral. But, and this may strike you as strange, people don't necessarily need to believe misinformation in order to spread it. And this is an interesting paradox. I noticed this during COVID. I noticed very reasonable people getting vaccinated themselves, but then saying the most awful things about vaccination. RFK Jr. is an example. All his kids have all the vaccines, and he's trying to deny them to every other child in America. Now, why do people do this? Why do they share misinformation they know is false, or information they know is false? They do it largely to signal a political affiliation. They do it to disparage opponents. They do it to accrue social rewards because they want to fit in. Psychological factors contribute to this significantly. People are more likely to share misinformation when it aligns with their personal identity or their social norms, or when it's novel, when it elicits emotions. And you'll notice I just repeated an exact phrase from 2 pages ago because I know repetition works. Even for real information, not just misinformation. Misinformation also spreads differently on social media than on legacy media, such as television, radio, or newspapers. Mainstream news outlets tend to have safeguards in place to prevent and correct false claims. But several unique features of social media actually encourage viral content. And they have very low oversight. Rapid publication, peer-to-peer sharing allow ordinary users to distribute information quickly to very large audiences. So misinformation can only be policed after the fact, if at all. And that's not useful. President Trump spoke to billions of people about Tylenol. Everything he said, every false claim he said got corrected, but it got corrected the next day or a week later. Too late. The seed has been planted, and people know that. Social media platforms have no interest in policing because they depend on clicks and shares. Also, policing's almost impossible. So we have this Wild West out there where anything can be said. We also have echo chambers that bind and isolate online communities with similar views. And this aids with the spread of falsehoods and impedes the spread of factual corrections. We know that on social media, you can live in a bubble. You can only hear things that you like and that you agree with. And that's not good for you. That's not good for your health. It's not good for democracy, but it's good for social media profits. This problem disproportionately affects individuals who consume content from conservative political sources. Again, we see this in the research, that those bubbles are much tighter and getting tighter. Again, a lot of this has been nurtured and spread by Trump and his acolytes. Algorithms that track user engagements, that prioritize what's shown, tend to favor content that spurs negative emotions like anger and outrage. Again, I'm repeating this point from earlier. If you can touch on emotions, you can have a lot more impact. Overall, most online misinformation originates from a very small minority of super spreaders, but social media amplifies their reach and influence. In fact, there's a fascinating study done during COVID that found that just 12 people around the world are responsible for most of the false information that's spread about vaccines. 12 people on a planet of 6 billion. This disinformation dozen produces 65% of all shares of anti-vaccine misinformation on social media platforms. And this is research done by the Center for Countering Digital Hate. So who are these mighty 12? I want to go through the list because I think it's important to understand where they're coming from. Number one, this is the king of the quacks, Joseph Mercola. He calls himself Dr. Mercola, but he's not a doctor. He's literally made hundreds of millions of dollars selling so-called natural remedies as alternatives to vaccines. He's been promoting anti-vaccine theories for decades. Among his greatest hits is claiming that both COVID and bird flu are hoaxes. And he has a long list of things that he claims. So look him up, Joe Mercola. Number two, Robert F. Kennedy Jr. Not surprisingly, he's now the US Health Secretary, but he's a longtime anti-vaxxer, aside from his own children, I mentioned. And he seems hell-bound to bring back childhood vaccine preventable diseases. Now the why, we can talk about later if you want. Number three, you may not have heard of these other ones. They're more in the background, but they're very, very powerful in the digital world. Ty Bollinger is a conspiracy theorist who spreads dangerously false claims about cancer treatments. He has a website called The Truth About Cancer, has millions and millions of followers, and he alleges, among other things, that chemotherapy doesn't work, and he sells people potions as an alternative. Sherry Tenpenny is an anti-vax zealot who clings to the false claim that vaccines cause autism, which has been debunked repeatedly. She also claims that COVID vaccines make people magnetic. So that's an interesting one. I tried that one out during COVID a lot. I didn't have any luck. It's putting a fork on my head didn't work. Anyhow, number five, as I work my way through the list, to my amusement, Riza Islam is a member of the Nation of Islam and the Nation of Islam Army. He's a prodigious spreader of anti-Semitic, anti-LGBTQ, and anti-vaccine rhetoric, particularly in the African American community. He posts and promotes a range of conspiracy theories. Number six, Rashid Butter is an osteopath who promotes the use of something called chelation therapy to treat a broad range of conditions. He said it can cure of autism, cancer, you name it. Even though there's no evidence this is true or effective, he actually has a very broad following. Erin Elizabeth is an alternative health influencer who blogs under the name Health Nut News, and she happens to also be the partner of Joe Mercola. So they all work together. Sayer Jai is the founder of an alternative medicine portal called Green Med Info, a website known for promoting a whole range of pseudoscientific publications. Kelly Brogan, a self-proclaimed holistic psychiatrist and reclamation queen. Not sure what that means, but that's what she calls herself. She's fiercely anti-pharma, but hawks a number of alternative medicines on her sites. Number 10, Christiane Northrup is a former gynecologist who promotes pseudoscientific alternative medicines and anti-vax conspiracy theories. She's big on the Tylenol thing too. Number 11, Ben Tapper is an anti-vax chiropractor who's the main proponent of the notion that COVID vaccines contained microchips that allowed government to control us. Maybe that worked on me, I don't know. Dr. Shahad, were you sending me messages? I don't know. Mostly he sent me messages on email the old-fashioned way. And number 12, rounding out the top 12, Kevin Jenkins is the CEO of Urban Global Health Alliance. You notice how they always have really fancy names for their groups. And he's a leader in the anti-vaxxer community, again targeting African Americans who have very, very low vaccine rates already. And there's historical reasons for people in the Black community to be skeptical of pharma because they've been used as guinea pigs and mistreated for decades. So there's some history there that people are tapping into for nefarious purposes. So why did I bother taking the time to list all 12 members of this disinformation dozen? For a couple of reasons. One, you should know where these falsehoods come from. They come from a very small core of very invested people. You should be on the lookout for them. When someone sends you information from any one of these influencers or their websites, your internal alarm should go off. I also want to drive home an important point, an important trait that every one of these dozen people shares. They actively and knowingly spread disinformation because it makes them rich. They're not doing it out of the goodness of their heart because they're committed to the wellness of children. They're doing it because it makes them rich, very, very rich. Joe Mercola is worth hundreds of millions of dollars. He has monetized lies. Every single one of them is selling some form of quackery as an alternative to legitimate drugs. They invariably denounce Big Pharma loudly and repeatedly, but they're all selling their own drugs, which are largely untested and unproven. We should start calling them Big Supplement. And don't get me wrong, I'm not saying the pharmaceutical industry is not without fault. It has many, many faults. But in terms of transparency and oversight, it's head and shoulders above almost all so-called alternative medicines. So the last issue I want to talk about, I want to get to your questions, that's always the fun part for me, is loss of trust. Trust is such a huge issue. Loss of trust and expertise in particular is causing us much harm. So what can we do to fight disinformation and misinformation? What can we do to rebuild trust in expertise? There's not a single or simple solution. We have to recognize it's going to be an uphill battle, an almost impossible battle to win in the short term, especially when so many people can benefit from spreading falsehoods, benefit economically and politically. As the old saying goes, a lie can travel around the world before the truth can put on its pants. And the truth is having a lot of trouble putting on its pants every morning. But there are nonetheless things that all of us, citizens, scientists, media, policymakers, politicians, corporations, there are things that many of us can do to push back. And again, no magic bullet, but a whole bunch of little things that we can do every day. Number one, avoid repeating misinformation and disinformation. When you do, inadvertently, which all of us will do, correct yourself as best you can. Don't let it lie. Push social media companies to understand and reduce the spread of harmful misinformation. Don't make it profitable for them to spread lies, which it is now. Number three, use misinformation correction strategies with tools already proven to promote healthy behaviors. Things like counseling, skills training, incentives, social norms. Make people feel bad if they're spreading lies. Don't just let it roll off your back. Number 4, leverage trusted sources to counter misinformation and provide accurate health information. This is really key for people who work in the healthcare sector because they're so trusted and so believed. They have to use that power. The letters behind their name, those are powerful to change people's minds and to address their doubts. Number 5, debunk misinformation often and repeatedly using evidence-based methods. Even though it's boring, do it. You don't have the emotion on your side most of the time, but sometimes you do. You know, tell the stories of kids who died before vaccines existed. Old folks like us, I lived in the era before vaccines. Every one of my classmates and myself suffered and suffered greatly. I personally was hospitalized with the mumps. These are not innocuous things, and we should talk about that reality. It's important to pre-bunk misinformation. And what does pre-bunking mean? It means educating people, inoculate susceptible audience by building their skills and resilience at an early age. It's so key in our education system, not just to teach kids stuff, but to teach them how to separate the wheat from the chaff, if you will, to figure out what's a lie and what's true and why. That's the most important skill we can arm our children with in the modern world. Not just reading and writing, but analysis of what they're reading. Demand data access and transparency from social media companies for scientific research on misinformation. Let them allow us to study the impacts, because we know they're great, but only when you understand the impacts can you counter them. And it's important for governments, policymakers, charitable groups to fund basic and transitional research into the psychology and the impact of health information, including effective ways to counter it. Now, what's the common thread in all these 8 things I named that we can do? The common thread is health literacy. Health literacy is so essential to our good health. And I noticed on all the tables there's little cards with promoting a report about health literacy, and I would urge you to scan it and take a look at it. It's really essential to your good health. The reality is in our modern life is that we're so marinated in social media that we don't know what to believe anymore. It's downright Orwellian out there. War is peace, freedom is slavery, ignorance is strength. These are things we hear repeatedly in different ways. Now it's time for me to wrap up, so I just want to return briefly to what I said at the beginning. Again, speaking to the power of repetition. The World Economic Forum's Global Risk Report identified misinformation and disinformation as the single most pressing risk of our times. And this is saying something. There's a lot of bad stuff going on out there. I almost didn't say stuff. Information disorder is often portrayed as the root cause of various public woes, ranging from climate denialism to political polarization. It's a societal disease. It's one that requires a large-scale and determined response. The problem doesn't lie solely in our inability to recognize unreliable news. Misinformation is a symptom of a deeper underlying malaise in society. Diplomats, when they negotiate the most delicate matters imaginable, don't talk about the truth, they talk about trust. We're living through a crisis of trust. The public increasingly lacks trust in the media, in expertise, in institutions, in democracy, and sadly, in themselves. Lies don't thrive in a vacuum, but in a climate already poisoned in distrust. Ultimately, it's the climate we have to change, and that's hard. So thanks for listening. I'd be happy to take your questions and hear your comments. Thank you.
Okay. Well, thank you, André. My head is spinning, as I'm sure everybody else's in this room is as well. I want to just first thank you for your insightful comments and reminding us how critical it is to protect trust and accuracy in healthcare. I love the disinformation dozen. I thought that was awesome. You know, as we've heard today, patients and families depend on credible evidence-based information. to make sound decisions about their health. And when misinformation spreads, it affects not only individuals, but our entire communities. On behalf of everyone here today, as well as my colleagues at the clinic, and on behalf of our members and patients, thank you for helping us shine a light on this critical issue and for encouraging all of us to be vigilant in defending facts and truth in healthcare. I'm just going to take a moment to also recognize the people that work with me to do this on a day-to-day basis. The Regina Community Clinic physicians and staff seated at table 8 and 9, if everybody could just wave and be noted. I think these are the folks whose dedication make events like this and our day-to-day care possible. So thank you very much, folks. So now we're going to spend a few minutes for questions, and there's a couple of microphones right there. And so if you have any questions that you would like to ask Andre, subject to this particular subject, please feel free to do so. I might take a little bit of license here because I've got the microphone, to ask a question. The first question I was going to ask, you answered already, so that's fantastic. I was going to ask, because of the work that our folks in the clinic do, as health professionals, how do you balance respecting patients' choices and experiences while still advocating for the evidence-based care that you know is the right way to go?
Yeah, I think that's a real challenge for health professionals, is you have that relationship of trust with your patient, and you have to maintain it above all. So I think you don't badmouth them, you don't say they're stupid, you listen, you say, oh, that's interesting, but here's something a little more that I believe and that is more factual. I think it has to be a trade-off. I think it's very difficult to change the mind of someone who has a set political, social view, especially if it's reinforced by their community. So you have to go at it slowly. I've written, many journalists have written stories about people who were, just fierce anti-vaxxers, and then they came around. And they came around over time, and they did it thanks to their health providers. Usually it happens with a crisis. I firmly don't believe in vaccines, but my kid's in hospital with measles. I'm going to get my other kids vaccinated, and pronto. So unfortunately, it often takes that, but I think it's a challenge for health providers. But, the relationship is so important, the discussion is so important, and if I can give a plug for your clinic, having people in a model where they're not on a timer, the 7-minute fee-for-service rotation, you have physicians on salary, they have more time to do that. It's an advantage. It's better for people and those really hard discussions.
Right. Great, thank you. Yes, please.
Thank you very much for the articulation of the environment we're living in today. You quickly alluded to you had hope for the future because of the young people. Can you expand upon, on a larger level, what gives you hope for the future in light of everything that you've presented today? What makes you hopeful for the future?
Yeah, I think the main thing is I'm not young. I've been around a long time, and I kind of believe in the pendulum theory. Things get bad, and then they swing back and get a little better. I think I'm also a big fan of history. I read a lot of history, and I think everything tends to be fairly cyclical. So I think, I hope we're hitting a nadir. I hope we're getting to the lowest point we can, although I have a sense we can get a little lower, at least south of the border. But I think as humans, that's what we do. We adjust. What's happening now politically is very understandable in the wake of a pandemic. I've studied a lot the 1918 pandemic. The exact same thing is happening now. That's how society reacts. We push back against something horrible, often by doing something more horrible. And again, it's human nature. I don't think we can change it, but we can understand it, and we can adjust to it. So, and again, young people are so smart, and they're so dynamic, and they know all this technical stuff that I don't know. So I think they're going to get a hold of, they're going to use AI for good. They're going to get a hold of social media and make it more livable and respectable. we're in this early stage still of social media and how it works, and I think we're going to clean it up and make it a good thing. So the young people in the audience, it's on you. You got to make it better. My generation, let me say, what's the polite word I can think? Screwed it up, and you're going to have to fix it. And when you fix it, make things better. That's what I tell my kids anyhow. It's all on you now. So.
I was just wondering if you had, like, I have experienced somebody in my family that got pulled under by misinformation, and it happened really, really fast, like before I could preempt anything. And I'm just wondering if that's happened to you, a family friend, or like just even a story that you've heard where it happens so quickly, and to try to bring that around because the algorithms get you.
Yeah, so I've heard hundreds, if not thousands, of these stories. It has happened in my extended family, which is embarrassing for someone who's a health reporter. But what's my answer? My answer is don't give up on them. Keep talking, listen, disagree politely, but don't let them go. Because, you know, if it's people you love, don't give up on them.
First, thank you so much for the words that were really great. You spoke a lot about social media and thinking about Meta's response to Bill C-18 by not allowing media to post on social media. Could you speak a little bit about the impact that has had in the increase of misinformation, and also what other alternatives would media have to be able to get back in that space, maybe through a different way to be able to combat that with more accurate and evidence-based information?
Yeah, so I don't know if you remember the good old days when social media with things like Twitter were new, and it really was a conversational space. It was fun, you learned a lot of stuff, but it just kind of got overtaken by trolls, by anonymous people, with political motivations across the political spectrum. And it's just not a fun place anymore, right? It's a place where if you use the old soapbox metaphor, where people would go in the public square and stand on the soapbox. Now if you do that, people throw rocks at you. If you're lucky, it's just rocks, right? So it's not fun. So how do we get back to that? I think the worst thing about social media is anonymity. You know, I used to be for 15 years I was on Twitter and was very active, and then gradually became less and less because it seemed pointless. Now I am on LinkedIn. So what's different about LinkedIn? Your boss is watching you, right? So people are civilized. Even when they disagree, I love disagreement, but they're civilized. There's no anonymity. I think that's where social media has to go. Again, that's what I see young people calling for, right? My kids' generation, they're in their 20s, they've kind of opted out of social media, right? They're on Instagram, but they just use it for messaging. They don't share their lives. They're much more cautious about what they share. They worry about their kids' pictures being used for nefarious purposes, so they don't post pictures of their kids. So they're learning how to control this stuff and bring it back to a place where it's safe and useful. So I think that, again, the future, it has to be a democratic process. That's what social media should be ideally, is a safe space for democratic debate. And to do that, we have to get rid of the trolls, we have to get rid of the anonymity, the ability to lie. You know, there has to be more policing of people who abuse the rules.
Great, and you have been patiently waiting, so I'll allow another question.
Thank you. I appreciate that. I was curious about your thoughts on virtual care and the way that the kind of healthcare space is shifting into opportunities for people to access virtual care. Do you see that as one of the most viable futures that exist, especially as we look at Saskatchewan and the populations around the province and how spread out we are? I'm obviously, as someone who is a little bit younger, not as young as your kids, but I see their potential to be a lot of good that comes from it, but I could also see there being some negativity just because people don't trust everything that comes online.
Yeah, so I think very, very important topic. To me, the key in there is care. So the important is we have to give people the care. To me, the purpose of Medicare is to get people the right care at the right time in the right place. So it's all about care. Virtual, AI, these things are tools. So we have to use those tools effectively. So it's often appropriate. We can do a lot of stuff virtually rather than people drive in, pay parking, waste 2 hours. You could do it 5 minutes. That's a good use of it. AI, we can use, doctors use AI now, AI Scribe, to transcribe their notes. It saves them inputting. Great uses of technology. But these are not substitutes for care. They're tools. They're adjuncts. So care always has to be at the center to me. I often get asked, I do a lot of forums like this, people say, is my doctor going to be replaced by AI? And my answer is no. Doctors who use AI are going to replace those who don't. That's the future. It's not getting rid of doctors. And to me, what makes me excited about new technologies is that it gives health professionals more time to actually do caring. To do hands-on. I love AI Scribe. My doctor uses AI Scribe. She looks me in the eye. She doesn't sit and tap on the keyboard anymore. Hey, how you doing? And we interact, and then some other little robot types up her notes. That's how it should be. The focus should always be on the person. Medicine is ultimately about people helping people. That's what we have to get it back to, regardless of what other fancy technologies we come up with, and there's going to be new ones. Thanks.
Thank you. Thank you. Thank you, Andre, and thank you, everyone.
If you'd like to share your feedback on the program you just watched, contact us today